What's up to all my 30 subscribers out there? Thanks for watching, guys. So in this video, I'm going to be talking about heartburn and some over-the-counter ways to help treat or alleviate some of your symptoms of heartburn. So stay tuned, guys. Alright, so before I get into talking about the medications that you guys could use to help treat some of your symptoms of heartburn, I'm going to give you guys a little background about what heartburn is and what generally causes heartburn. So heartburn, to simply put it, is a condition where you have too much acid in your stomach, and that acid is going to places you shouldn't be going, causing you to have that burning feeling. So one place you shouldn't be going is your esophagus. And just a little side note, your esophagus is that tube that that food goes through when you swallow, that leads food into your stomach. So when there's acid in your esophagus, that causes that burning feeling in your chest that you call like, oh, my chest is burning, or I have heartburn. It just means that there's acid in your esophagus. It's not in your heart. So that's one way heartburn is manifested. Another way is whenever there's acid kind of below your stomach, kind of going into your like smaller intestines. In that area, that might cause some stomach pain as well. But generally, that's what heartburn is, just like a overflow of acid. So now we're going to talk about what causes heartburn. So most of the time, heartburn is caused by diet and lifestyle. So people who are generally overweight, who smoke, who don't exercise, these are all risk factors that increase your chances of having heartburn. In addition, it's your diet as well. So people who eat spicy foods, citrus. So remember we talked about having a lot of acid in your stomach. Now you're adding more acid because there's acid in like citrus and there's acid in like spicy foods. So that's, you're adding more acid, you're increasing your chances of having heartburn. As well as people who drink a lot of alcohol and carbonated beverages. Those are just a kind of quick list of like risk factors or things that kind of trigger heartburn. So my advice is to like minimize those, or like kind of keep track of what's causing your heartburn. If you're drinking a lot of alcohol that's causing your heartburn, maybe minimize the alcohol, or maybe minimize this kind of like the peppers you eat during lunch, or maybe not eat too many oranges. That's causing your heartburn. So you gotta kind of keep like a diary of and figure out what are your triggers. But again, like if you're not sure about what's causing it, you should also see a doctor and they can kind of give you a more thorough evaluation of it. Okay, so now about the medications. So we're gonna talk about 3 different classes of medications, and I'm gonna talk about in the order of the medications that work the fastest, but also kind of the effects wear off the fastest as well, and then it's gonna get a little longer and then even longer. So the first class of medications is called antacid, or commonly known as Tums. That's the brand name, Tums. That's probably people recognize the most. So Tums is basically it's like calcium carbonate, which is basically neutralizing the acid in your stomach. Let's say you have a lot of acid in your stomach, you eat that. You take Tums, it kind of goes into your stomach and then it binds to the acid and just neutralizes it, like makes it like, oh, it's not acidic, it's not basic, it's just neutral, and that causes immediate relief of your symptoms. This is really good if you're having like you're just having heartburn, like maybe like very rarely you just want to get rid of it. It's a good way of getting rid of the acid. But also if you have consistent heartburn, this isn't really a good choice because it's gonna wear off pretty quickly. So if you take one, then it'll help you for a little while, but then after a long time, you're gonna need more stronger therapy. One thing I did want to mention about antacids is that you want to limit the use for over-the-counter for no more than 3 days. So after 3 days, if you're still having heartburn, then we suggest then go see a doctor to get that checked out. So for over-the-counter antacids, no more than 3 days. So the second class of medications you guys could use to help treat symptoms of your heartburn are called H2RAs, or the full term is Histamine 2 Receptor Antagonist. These basically work differently than antacids. Antacids, like we talked before, they neutralize the acid in your stomach. So H2RAs, they don't neutralize the acid that's in your stomach. They prevent your acid from they prevent your stomach from making more acid. So your stomach has a process where it goes through steps to make acid that kind of comes out into your stomach to help break down food. H2RAs block one part of that process, which overall limits or reduces the amount of acid that your stomach produces. So a common H2RA over-the-counter medication is called Zantac, is the brand name, and the generic is ranitidine. This is a common H2RA that people use. Some things to note about taking it over the counter is you take it as needed. So you're not supposed to take it every single day. If you want to take it over every single day, you should go get a prescription from a doctor, and so that he could make sure it's right for you. but for over the counter, you take it as needed. And also, as a recommendation, you could take it like 30 minutes to an hour before you eat a meal to prevent the heartburn. Now we're going to talk about the third class of medications called proton pump inhibitors, or PPIs for short. So these medications are the ones that take the longest for you to see the effects, but they also work the best in the long term. So the way these drugs work is very similar to how H2RAs work that we talked about earlier. These drugs lower the amount of acid your stomach produces, and thus lowering the feeling of heartburn. These medications, just like H2RAs, are limited to only 2 weeks or 14 days of use. So if you're taking these for more than 14 days and without seeing a doctor, then you should stop the medication and go see the doctor before. So common names for these medications are like Nexium, Zegred, Prilosec. They're kind of over-the-counter medications of PPIs, or proton pump inhibitors. These medications are generally more expensive. Like, I've seen them around like $30, $40 for a 2-week amount of medication. So they're a little more expensive, but they do work really well, which is kind of why they're a little more expensive. So now you're wondering that, wait, H2RAs, PPIs, they sound so similar. They 14 days. What are some of the differences? The differences between H2Rs and PPIs, in terms of what you guys should know about, is H2Rs, like we talked about, is taken as needed basis, so whenever you think you're having heartburn. But PPIs are taken daily, so like you should take them every day for 2 weeks, generally in the mornings before breakfast on an empty stomach. That's when you take PPIs. So that's one of the major differences. And then again, like we talked about earlier, is PPIs generally last longer than H2Rs, but also take longer to work. So it's like a tier system where like PPIs work the best but takes the longest, H2RAs then antacids. One thing I always recommend to patients, and I've seen recommend to patients, is like somebody comes in, they have heartburn, but they also say like, oh, I've been having heartburn so much, I've been having heartburn like for a lot regularly. What I do recommend is I recommend them getting antacids to begin with, just to help alleviate the current symptoms of heartburn. And then I recommend like a PPI, like a Nexium or Prilosec, to help them for the next like 2 weeks until they see a doctor. So that gives them enough room to help alleviate their symptoms, and then also covers them until they have time to make an appointment with the doctor, see a doctor, get the prescriptions. The whole process is like, we don't want the patient to have heartburn during the whole process, so that's kind of the regime I recommend.